Record to this computer, okay?
Yep, and now it's recording. If you look at the top.
It says we're live. Okay, we're gonna get going here, and I'm gonna call you back.
All right.
So that was behind the scenes as we continue to embrace technology at the Georgia Council on Substance Abuse and at our the wonderful RCOs across Georgia, like the Change Center, to bring the message of recovery during COVID-19. And today, the wonderful Facebook Zoom connection is just not working, but William saved the day for us. And so we're gonna do this Zoom right now, and we're gonna post it to social media after the fact. So that's what you were just seeing, and I'm so thankful for those of you that view this. I'm Jeff Breedlove, a person in long-term recovery, and I have the privilege of working at the Georgia Council on Substance Abuse. And under the direction of our leader, Neil Campbell, we want to reach out to all the RCOs across Georgia during COVID-19 and hear real-world stories, things that are going on in Georgia communities that impact the recovery community as they relate to COVID-19. And I can't think of a more important RCO to hear from than the Change Center, because unfortunately, Southwest Georgia in general and Dougherty County and Albany in particular have been a hotspot. And if you've followed the news at all in Georgia, you've seen what that community has had to deal with, and the good and the bad. And we have a long-time friend of the Georgia Council on Substance Abuse and a recovery leader, Catherine Newcomb, on with us today to give us this perspective from the Change Center. So Catherine, thanks for being here, and just give us some insights as to what you're seeing in Southwest Georgia.
Thank you guys so much, Jeff. We appreciate the opportunity anytime we get to advocate or inform the public of like what we're seeing down on the ground. So we appreciate you definitely. So, you know, there have been challenging times, but they have been times that we have been able to grasp a hold of new opportunities and new outreach, friendships and connections and collaborations. I think first of all, we want to focus on the virtual option with the high infection rate and the hotspot. And, you know, if we wouldn't have got those up and running so quickly, I don't know where some of our peers would be. We actually reached out to a woman in Valdosta, and when she was on the Zoom meeting, she was in one of the daily reporting centers there, and she also is a sex trafficking survivor as well as a person in recovery. And she told, I get emotional, sorry. She told us that day that if someone wouldn't have shared that meeting ID number with her, that she was going to end her own life. And you know how powerful that was? It shook us for 2 days, and we were able to connect her up with Athens so that there were some women with lived experience there that can kind of walk her through those things. But if you think not being on a Zoom meeting doesn't matter, you're so wrong. You know that just to be there for people to have that outlet is it's an amazing gift, and we're so grateful for that. We've also been able to bridge some gaps with long-term treatment centers and then some of our individuals in the jail here in Dougherty County. As you know, they're of course releasing a lot of different people, but the thing is there aren't any options for any type of treatment. All of the RCOs have been amazing working together, putting together treatment lists of how and where we can get people to find and sustain recovery and the help they need. Our long-term treatment facility here, which is a 1-year facility, we were actually able to connect 2 of their individuals after they graduated. And one was with a job and a halfway house in our district, and he actually will be managing that halfway house. So he's like connected for the next year, which we know just ramps up the ability to maintain that recovery and for him to continue in a successful lifestyle for him. The other is that he graduated in January, and he is now employed at our local behavioral health crisis unit so that he can share his lived experience. And through collaborations with the Salvation Army here, He was able and qualified for the rapid rehousing funding program and got his own apartment last week in the midst of COVID-19. So that was definitely a challenging one as well. You know, some of the things we've seen are the lack of PPE equipment, the lack of people being able to get food. Number one, get to a place that has food, and number two, do they have groceries there? You know, and the answer is it's very odd when you walk into a grocery store and there's no meat and there are no eggs and there's no water. It's alarming to me as a person in recovery. We've never seen anything like that before, but I think about all of the barriers and challenges as to how do I get there? I don't have a mask to wear. I don't have the proper funding. I don't have a bus pass. I get there. They don't have the groceries I need. How do I get home? How do I have the supplies in place to take care of myself afterwards? And so we tried to remove some of those barriers by collaborating with, again, the local rescue mission, Salvation Army, the Homeless Coalition, because they are doing food drives, but you can only go in your car. And as we know, people in early recovery and sometimes long-term recovery don't have vehicles. And so how do we assist them in that without putting a ton of people in risk and loading them in an SUV? And so through collaborations with them, we're actually able to go once a week and pick up 4 to 6 boxes that we can take to our peers that are most in need. I think one of the biggest things that the Change Center has been able to do is keep the doors open and provide face-to-face connection safely, of course. And we had to kind of design a way that that works so that we can still provide what's essential. People still need to use computers. They still need to reapply for food stamps. They still have things that they need to tend to through the Social Security Administration. They don't know how to use Zoom. They don't have extra minutes so that they can keep those connections. So we are here and available for all of those face-to-face needs. I know that has been trying, but we have been here, and we have been here every day since it has started. I know we are connected to Aspire Behavioral Health, and we're one of the only service providers that are still open. And that is for those core services that actually need to take place. There are people that need medication. They need to speak to their therapist. They need new skills to adapt to the times and to deal with the anxiety and the stressors. You know, we need that too. I was listening to Jamie earlier, and you know, there have been 2 or 3 weeks where all the peers here had to sit down, all our peer recovery coaches, and say, okay, so like, what's going on with you? And I'm not in a place where I can do that today. And then we decided to reach out. We have a peer workforce of 23 people all across the region. And so we decided to start reaching out and supporting our peer workforce, our CPSs and our cares, because if we're struggling, we know that they're facing the same things. And we know in recovery, one of the most beautiful gifts is being able to be of service to someone else. So that's kind of where we dove our focus in, is to not only our peers, but like driving to support the people that support our peers on the outskirts. And so I'm so grateful for Neil's words of lead with love. That has what has kept us going, because there are some times when you want to pull in and say, like, I'm fearful. There are cases everywhere. There are employees. Our medical director, Mr. Fowler, one day when he did a presentation, brought a body bag up to the podium with him just to make a visual representation of how serious this was. And if you don't think that that doesn't like shake you to your core, it really does.
I can only imagine.
Yeah, I mean, I'm like, here's our coroner with a body bag saying, I don't want to put you in this. And it's like, whoa, you know what I mean? But we need to see the severity and the ramifications if we don't do these things. And so thumbs up to him, because that was a bold and amazing move, though. I think it really made an impact on our community. But we're still here to serve. We're doing that the safest way we possibly can. And that assertive phone calling, I think we've talked to over 300 people this month alone.
Wow.
Um,
300
so
people.
300 people.
That's a big number.
That's a huge number. We've had almost 200 in meeting attendance from April 1st to, what is today, April 28th or April 29th. So we've been able to provide that many one-on-one supports to individuals in our community.
So what inspires me as you share these real world stories is, I know that up here I live in the shadow of the state capitol, and that's where they make a lot of decisions that impact everybody's lives, but certainly the lives of people in recovery and dealing with mental health issues. And the Atlanta News over and over talks about Albany and Southwest Georgia and a hot spot. And, you get these 30-second, 1-minute clips on the news about it. But what you're sharing is some real world facts, real world situations. And the reality is they're going to pass a state budget in June that's going to impact the recovery community. And they're going to have to make tough decisions. I think everybody respects that reality. But, what I'm hearing from you is the exact reason why it's so important to support recovery in general and RCOs in particular, because, there are people in Georgia who absolutely positively have their lives saved, literally in some cases, and are protected and don't return to active addiction because of a team of peers at an RCO who can do things. And in a way, if you think about it, that makes a community stronger in good times. It certainly makes it stronger post a pandemic like COVID-19.
Yes. My concern with the budgeting is, so these are the people that we've been able to connect to. I think about there are hundreds and thousands that we haven't been able to. And so when people can come out and come back into the community and it's safe to have these interactions, and we start picking up pieces that aren't even evident as of yet. Will we be in a position where we can do that? Will our local stakeholders, support us? Our community is struggling, even though it's safe or it's been said that people can open the doors. Our local restaurant community has band together and is not. Our churches are not resuming services. It's just not safe to do that yet. And that lifts my spirit, because that is community where we decide outside of, state government, locally in our community, what's best for overall success. And so we see that, and it's absolutely amazing. But I do think about the future, the next 3 months, what are the things that we're going to come across that we haven't even planned for? Because, this is the first time anybody's done this. So it's all trial by error, really. And so our funding and to be that place in the center of the community where they say, I don't know, but I know the Change Center knows.
Exactly right. That's exactly right.
Right. I don't know, but the Change Center
I've been to
knows.
Albany many times over the years when I was with the Deal administration and other places, and I've been to the hospital. I've been to the technical college. I've been to the Change Center. I've been all over. I've had a lot of good barbecue there. And it's a great community, and there's great people there, and they're making smart decisions now. But we know historically that when Katrina hit New Orleans, it was for a year afterwards that these secondary medical issues came in after the impact of the initial storm. And chief among those secondary medical issues was substance use disorder. And we know that that's already happening with COVID. And you're 100% right. This is the stories we talk about now are just the people we have come in contact with. As we emerge from COVID-19, the secondary medical issues are going to present themselves in dramatic and devastating ways. And our hope from the city level to the county level and the state and federal level is that our leaders understand that what's about to happen with substance use disorder and mental health issues is going to be extremely serious across the state.
Yes, I think we just ask for the support to continue to lead with love. If there aren't people here in the rough times, there won't be people here in the so-called quote unquote easier times. And so, you know, we have made great opportunities out of the challenges presented, but we still need the continued support.
Well, Catherine, you've been great with your time today. I know that you and the entire team at the Change Center and Aspire and the peer workforce you referenced across that region.
Yes.
Folks are going above and beyond, putting themselves in, trying to do their best to stay safe, but nevertheless put themselves in harm's way for the good of others. It's respected, it's loved, it's appreciated. I want to encourage everybody to follow the Change Center and Aspire on social media. I know they're on social media, they're very active, and they deserve your support. We want you to know you're not alone.
You're never alone.
Please keep up the good work.
Thank you so much, Jeff. We appreciate you and the council.
Well, thanks. And as we always say, recovery is real. Thanks, Catherine.
Thank you.